Greetings, this is Mushtaq Memon, Professor Emeritus from Washington State University. I am delighted to be in Istanbul, Turkey. I came here about a week ago and, hosted by my very good dear friends here. I have with me Dr. Meral Gökdağ and also Dr. Erhan Gökdağ. They both are veterinarians and practitioners from Izmir, Turkey. So we have had quite a bit 1 week here. We had the participation in the conference, Small Animal Turkish Veterinary Conference. And after that, we also visited University of Istanbul veterinary faculty. So we had presentations there. So I thought we may go ahead and do some conversation about our veterinary profession and their engagement in it, and then also maybe future plans for their practice and also Turkish veterinary medical profession. So welcome,
Thank you.
Dr.
Thank
Erhan and
you.
Dr.
Also
Ena.
welcome you to
Yeah.
Turkey.
Yeah. So I have just a few questions. I'm sure our listeners will be curious about your background and where did you get education and now what you're involved with. So maybe if you could start, Dr.
We say
Erhan.
ladies first.
Well, that's okay too. Yeah, we can do the ladies first. Please go ahead.
I was graduated from the Veterinary Faculty, Ankara University Veterinary Faculty in 92. And after that, in 2006, I had my PhD degree from Bursa Uludağ Üniversitesi Veterinary Faculty. And we were working together till 92. And we were first working on farm animals. I was a cow doctor then. And then after some time, we have begin to work only for small animals. And now we have a hospital in Izmir, Urla.
Yeah. I'm her classmate, and we met there. And at 92, I have degree also from Ankara University. And then we go to my hometown. It's Urla. And we established our first clinic in Urla. As you said, we make with farm animals, horses also, for a very long time, nearly 15 years. And after then, the change of the environment takes us to the small animals. And now we're just with small animals, dogs and cats especially.
Wonderful. Wonderful. You know, it just caught my attention. You have a PhD too, Dr. Erhan?
No.
No. I was just curious. So, PhD, I have a PhD too, but when I got PhD, I was more in a mindset of research. So, how you, being a clinician, also got PhD?
It's something different in Turkey. In Turkey, after the high school, we go to a big exam in the country, and according to the points we get, we can choose the university we want to go. I choose veterinary faculty, and after 5 years, we can work as a vet, as a clinician, or in the government everywhere, or as a vet. And after that, if you want to stay in the university, being a research person, and you get your PhD there, and you go on there. If you are a clinician, if you are out of the university, then you admit to the universities. You can have 2 years. You can work with the university for 2 years. You write your papers, and then you make your master degree, something
Okay.
like that. You can work like that, or you can have 4 years education in some kind of work, and then you get your PhD degree. But you are a clinician outside. You make your own work. I made my PhD degree because we were planning to have a hospital, and in my country, when you want to open a hospital, there must be somebody with PhD. So I prepare myself for our future work. It's the time where I can do it more easily. He's working, and I get my PhD degree in another city, 4 hours away from Izmir. So every week I go there and come back
See.
again. So in that time, it's the best way I make the PhD. So I did it.
Wonderful. Two questions.
Yes.
I just want to make sure that I understood you clearly. Number one, you mentioned that seems to be a difference between clinic and hospital.
Yeah.
So if you have a clinic, probably you have one or two veterinarians, but if you have a hospital, means you have more than 2, 3 veterinarians.
Mm.
But to have a hospital, you have to have a PhD.
Yes.
And the PhD which you did, I'm getting impression that, so really you did PhD in clinical subject.
No, I didn't at that time because uh, now it's easier. But when I attend to the university for PhD, it was very hard. They don't want to get clinicians at
Okay.
that time.
Okay.
Now it's very easy. Every faculty gets more and more students for PhD from the clinician, not PhD, because in PhD you have to have more exams. It's a little bit hard, but most of our clinician friends makes their master degree very easily now in nowadays. Uh, when it was 25 years ago, it's not easy. For example, if you want to go a PhD in a clinical site, you have to be there. You have to live in that city. You have to be there in 5 days and maybe in at nights. And there was no university in my city, so going and coming back is not easy. So I made my PhD degree in seminal artification under terrigonology.
Oh, okay, wonderful, wonderful. Yeah. So could you tell us a little more about the current practice? What type of practice it is? You mentioned about dog and cat. Do you see also some exotics? Is it only Western medicine, or you also include some complementary medicine? What kind of diagnostic facilities you have? Because I see some hospitals have, CT scans, MRI. So what is the extent of your practice?
Yeah. As we told, 15 years with farm animals, and after then, in this time, we see that the farm animals are not existing long in our region. So we began to specialize in some kinds of things for small animals because it's very different,
Sure.
farm animals and small animals. So we began at this time. I take courses. My favorite things is internal medicine and orthopedics. So I get different kinds of courses. I attend them. Operation techniques for orthopedics, and at this time we began also establish some associations where I be active there. We established in Turkey the first orthopedic veterinary association, and I was one of them. At this time, we gave courses to other veterinarians, clinicians at this time, and we use also our facilities for them. So now we are in the hospital time. I called in the hospital time. We are a little bit specialized in internal medicine. So is also our veterinarians and orthopedics and integrative medicine also.
I see.
Is the half of our work.
So, are you 24/7? Are you open during day and night, or what kind of timings you have?
If you be a hospital in Turkey, you must work 7/24. In clinics, it's not a must. They can, but it's not a must. And also, we can hospitalize patients, and we have also an ICU unit.
So I'm assuming that you are more than two in practice. You have more veterinarians.
We are not supermen. We have staffs.
We are 10 vets, Two of us have PhD, two of us has master degree, and the others are more than 10 years working with us. We have 7 technicians. Totally, we are 26 person.
I see. That's quite a practice. Yeah, wonderful. Again, I'm curious about. So you have total of 10 veterinarians. It's easy to find veterinarians in Turkey.
It's not because for our condition, we are not in the center of a city. We are a little far away from the city. So sometimes young people want to be in a city.
Sure.
They want the active life,
Activity,
everything.
yeah.
This is one disadvantage for me. The second, the younger doesn't want to work so hard as we did before. So when they begin, after some time, they want to go away. And sometimes they think they will earn more and they open their own clinics like that, something. So it's not easy to find a good person and keep it for a long time. And also, it depends on the aura of your clinic. Maybe you are very good, but you cannot connect with the others, then it doesn't work again. So we try to make them like a family, it connect each other. Because when you are connected, when you can make their communication better, they can teach also each other. Now I have a PhD and a master degree vets. They always show something to the others if they want to learn. So it's a good communication, and it when it's like that, we can do more about our patients. And a little bit being obsessive is good in veterinary practice, I think.
Good,
And
good.
what I have to tell extra to her is if you have specialized persons, you must take care of their belongings, what they want. Our staff is very specialized and they want special things. That means they want equipment. If you don't give the equipment
They
that
don't-
want,
not happy.
they are not happy. So we are permanently buying new technologies for them to be upgraded, and they become more excited
Almost
to
like a
work.
toys. It's toys
And
for them.
yeah, these are our toys. It's exact this, and they love it. If you don't do it, you escape
Lose
them.
them. I
You
see.
lost them.
Now you mentioned about your practice as Western and complementary. What are those complementary, modalities that you use for diagnosis or treatment in your practice?
I must go a little bit back in the time.
Yeah, please.
I was born in Germany and lived there for a while, and then returned back with our family to Turkey.
Okay.
So I speak very well German, better than English.
Okay.
Maybe better than Turkish.
So if I get interested in alternative medicine, I turn me to German because German is one of the main countries of alternative, and they have also educations there.
Alternative or integrative?
Integrative,
But that
alternative.
time it
okay.
was
Alternative
alternative.
at this time. So I turned for the courses to Germany. For many times, I get my educations, my laser education, my acupuncture education at the RTF at this time. My auricular therapy education was also from the RTF, and osteopathy is also given in Germany. So I learned many things from Germany that I can't tell now. Everything what I learned, there are more than 20 things specialized. Small, most of some of them are very specialized small techniques that I integrated in my daily practice. But it helps me very much because if we look on one side, from the Western side, to our patients, we lose something.
Okay.
Everybody knows that, But I found a way to see the complete patient. And so I use all these techniques every day in my examinations. At the first, at the beginning of my journey, I said journey, I'm not on the end, still searching for something. Uh, my patients uh, were say, "Oh, what's he doing now? What's that? What's that? What are you saying? Are you talking with an animal?" I said, "No, just be calm and see what's coming out."
Sure.
And
Sure.
with the time, they told you about my techniques. It's miracles, but it's not a miracle. That is all learned things
Sure.
that have a background. And now they are very pleased that I look in my way to their animals.
Because it's not hurting them.
Yeah.
And you see the papers with blood test, everything,
Mhm.
and the X-rays, and then you see the animal. When I begin to my first job 30 years ago, there was no paperwork. We were looking at animal, the eye, mouth, everything.
Right.
But now I see everybody sent the blood, sent the X-ray, and then they even don't look at the animal.
Right.
They just look at the papers. They don't listen the
Patient owner.
owner. They don't look after them. So I put some papers everywhere, and I ask, "Have you checked the abdomen? Have you checked this one? This one? You want our we always remember
Right.
our stuff to do these things, because when I get one new one, I see they do not do it. So we say, first you have to do it. You have to write everything on papers. So I will be sure you look at it. And I always check them if they are doing this in a good way or escape it. I always check them.
It's it's an interesting point you mentioned, and that's my observation almost all over the world, especially advanced countries, even in the United States. Person like me, old-fashioned, still I emphasize on physical examination. And our students are not taught very well physical examination, and they lose it, as you said. They, rely upon laboratory testing, and then on the computer, and then don't go very far. Now, as I understand, you have now this new relationship with traditional Chinese veterinary medicine, and you have become the Chi University affiliation here in Turkey, so you're called Chi Turkey,
Turkey.
Yes.
which means that you will be offering, or you're offering some acupuncture courses, some other Chinese-based herbal therapy. So where are we with that? Could you give us some update on that, please?
I will say the
Okay.
first. Okay, in 2024, we meet we meet with the Chi University, and we make a contract with them, and we say we want to teach acupuncture. By the way, you,
Yes.
and we opened our course last year, first course in small animal, and now we have 15 people, three classes, 15 people. Three person will finish 1 month later. So 1 month later, we will have 15 CVAs in Turkey.
Certified
Yes.
veterinary acupuncturist.
And 10 days later, we will have our first food therapy course.
Wonderful.
And next year, I mean in 2027 in March, we will open a small animal course again, and equine course for the first time. And we are planning to open the rehab course also.
Wonderful.
Maybe later herbal, but a little bit time for herbal, maybe 2 years later. And we want to have the four branch of Chinese medicine, both CVA, food, herbal, and tuina, and plus rehab in Turkey, because I believe we have too many veterinary faculties here, too many students are graduating every year. So we believe, even I told you now, the clinician can make master degrees more easily. I think integrative medicine is also a good way, and for future, it has a very big place, I know. So we will open our new courses. We will tell all about to our future veterinary practitioners, and we will have good things. We will have good jobs, I think.
Thank you. By the way, as you mentioned about, now I understand a little more masters in clinical discipline, and you intend to offer all the TCVM modalities. Just briefly, information I have is that Key University offers also masters in integrative veterinary medicine
Yes.
and also masters in TCVM. So just an idea that if you decided to, complement Turkish education with a master's degree, that maybe just adding few more things, you could start giving a
I hope.
master's degree.
For example, two of our friends are planning to go to Florida now. They are
Okay.
preparing themselves,
Okay.
and they want to go on with Chi University.
Wonderful.
Yeah, we are preparing them for this.
Wonderful. Well, as you know, I'm also involved with the World Association of TCVM, so I become very happy to go to different countries and try to expand this knowledge. What do you see? I mean, Turkey is such an important country in my perspective, between Asia and Europe. Do you see any expansion? I know, I mean, you are just starting here, and I'm asking you something in future. Do you see any markets, any places that, rather than people go to United States or Europe, they can come to Turkey and through your, institute or Chi Turkey, they can learn and get some more education. Do you see some potential there?
Of course, Turkey has this potential because Turkey is growing. And it's very fast growing in everything that you can think, and also veterinary marketing. And we know that the market is depressed for many things. So we need to get a better relation to this market, new things. And acupuncture is here, I think, the best way, because you need just the education and just needles, nothing more.
Right.
It's all knowledge, and you can work everywhere, because to establish now a clinic, it costs very, very much money. So most of the graduated students don't have this money. So it's very strange to open a new clinic, and there's not many working places for them. Also, if we see in our region, we have many, many small countries. Some are bigger than Turkey, but they don't have also veterinary acupuncture there. So we have to invite them to come to us because it's near. The geographic location of Turkey is 4 hours. In 4 hours, you can reach more than 100 countries.
Boy, that's the news to me. That's
No,
Yeah.
From Europe, you can come mostly 4 hours. Is the longest
The
way.
longest way.
From Azerbaijan, from Iran, and we, for example, we live in Izmir, and from Izmir you can have many places international flights, and as Chi is international school,
Yes.
and as Chi certificate is international, uh, as Erhan went to Germany to get some courses, we invite our neighbor countries veterinarians to come and get Chi courses from Turkey from us.
Wonderful.
We try this also with my colleagues from Germany. They come to us for small working groups.
Okay.
We work with them for 1 week. We have fun.
Wonderful.
We meet together and
Wonderful.
we learn together. And this is the professional way that we go with Chi University. So we try it and it works. We know it that it works.
Thank you very much for your time and your friendship.
Thank you.
And we wish you well and look forward to seeing your future venture and adventures, success in your all the attempts. Thank you
Thank
very
you.
much.
Thank you very much.